All right, moving right along. You've heard of UnitedHealthcare. Of course you have, especially after the CEO of UnitedHealthcare was shot dead by a guy named Luigi Mangione, 26-year-old man, who said that he was tired of hearing words like delay, deny, and depose. And those words were written on fired and unfired cartridge cases that suggested that Luigi Mangione had a motive related to that company's practice, well, the entire industry's practice. But Brian Thompson was the CEO of UnitedHealthcare, who was shot dead on a New York City street in December of last year. UnitedHealthcare, let me refresh this particular topic of this so-called Medicare Advantage scam. I've said from the beginning, they have very slick commercials on television. Oh my God, it makes you sound like, oh, what the fuck? Everything is free. What am I doing with Medicare? Ow, let me out of here. This is a Ponzi scheme, if ever there was one. It's run by hustlers, liars, con artists, and people who don't give a rat's ass about your health or your doctor or where you go when you need hospitalization. They don't care. All they want is your money. Well, UnitedHealthcare is collapsing because of the usual mismanagement, theft, lies, deception, just like Senator Rick Scott of Florida, when he was the head of a medical health insurance company. And it was convicted. Yeah, the company was convicted. Rick Scott slid off like the greasy, bald-headed fuck that he is. But that company that he ran was convicted of the largest Medicare scam in history. And then the son of a bitch wound up as governor of Florida, which will give you a clear indication of the mental capacity of Florida voters. And then he wound up as one of the senators from Florida. But I'm talking about UnitedHealth, that bullshit company. As reported by this woman, her name is Emma Freer. She's senior policy analyst for healthcare at the American Economic Liberties Project. She said that in early April, last month, market analysts said that UnitedHealth Group was a, quote, tariff safe haven, end quote. Right. And why not? The Trump administration had just announced an increase in payments to Medicare Advantage plans scheduled to go into effect next year. So that had to mean that profits would likewise increase at UnitedHealth. Not only the nation's largest insurer, by the way, but specifically UnitedHealth is the largest provider of Medicare Advantage plans. Now, I'll say it again, and you've probably figured this out on your own. Medicare Advantage is horseshit. It's a scam. It gives you nothing. It takes from you with the idea that, oh, I'm getting something. Oh, look, here's an Uber driver to take me to my doctor's appointment. Oh, glory. 2 months after that statement that UnitedHealth Group was a tariff safe haven, the company is in a state of free fall. Its collapse, Ms. Freer writes, reflects not simply the troubles of the broader healthcare market, but also the troubles with Medicare Advantage, the program set up with the bullshit idea and the lies that the private sector could provide better health care than traditional Medicare and at lower prices. Isn't that what we always hear? Well, the private sector is a lot better than government interference. UnitedHealth now faces three federal investigations. And you know what's going to happen to those investigations. They are going to disappear because one of Trump's little cadre of bitches runs the Justice Department. And Ms. Pam Bondi will immediately or sooner get rid of these cases against UnitedHealthcare. Gone. Now, according to the woman writing this piece, Medicare Advantage has only succeeded in, I like the way she puts it, juicing corporate profits by charging more and denying more care than traditional Medicare. Oops, what? Well, that's not what we see on the TV commercials, is it, Truth Seeker? Huh? And she goes on to say that as for UnitedHealth Group, it's looking quite possible that the company's bottom line was padded by billing fraud and patient abuse. No, really? Oh, how could that be? UnitedHealth was only in business to provide, care and assistance and medical health, whatever. So what's this about billing fraud and patient abuse? Oh, my goodness. Somebody must have made a mistake here. Anyway, UnitedHealth faces 3 federal investigations, and those investigations are taking a look at allegations of civil and criminal fraud, antitrust violations. And in February, the Wall Street Journal reported, for instance, that the Department of Justice is investigating whether UnitedHealth made its clinician employees' record, the doctors, nurses, whatever that work for them, questionable diagnoses that make Medicare Advantage patients appear sicker than they are. Now, that practice is known as upcoding, and it triggered extra federal payments. If you upcode, you get more money. Now, very little of that money goes to the actual treatment of patients who desperately need some help, but it goes into the pockets of these fucking corporate executives who make $15, $20, $30 million a year off of sickness and disease and fraud and lies. Oh, by the way, after the Wall Street Journal published that article, UnitedHealth told the Journal that it stands, quote, by the integrity of our Medicare Advantage program, end quote. Oh, of course they're going to issue a statement like that. What would one expect? This is the worst example of capitalist corporate America. Predatory, lying, taking, cheating, deceiving. So what are they going to say? Oh, you caught us. No. They're going to say, we stand by the integrity of our Medicare Advantage program. Yes, we do. It's making all of us rich. Fuck you. You can go die of your cancer. We don't care. We're going to deny your treatment anyway. Last week, The Guardian alleged that the company secretly paid nursing homes to prevent or delay transfers of Medicare Advantage patients to hospitals, and that saved UnitedHealth enormous money. But it cost the patients needed care, and in so many instances, their lives. But UnitedHealth, they don't give a fuck about what. Did you die yesterday? Oh, well, we're sorry. Anyway, we made a lot of money on your useless ass, so go get cremated or buried, something. The Guardian reported this, quote, at least one person lived with permanent brain damage following his delayed transfer. That's according to a confidential nursing home incident log, recordings and photo evidence, end quote. 5 current and former UnitedHealth employees told The Guardian that the company, quote, pressed nurse practitioners to persuade Medicare Advantage members to change their code status to DNR, or do not resuscitate, which rendered them ineligible for, quote, certain life-saving treatments that might lead to costly hospital stays, end quote. UnitedHealth denied the allegations, even though the fucking proof is right there. But deny. That's all you have to do. That's the Hitler, Trump, Netanyahu, Putin way of doing business. Deny. Deny what? What the fuck are you talking about? That never happened. That's bullshit. That's fake news. That's made up by these goddamn like NBC and ABC and C. You know, they're liars. Believe us. Believe us. Now, UnitedHealth's problems are going to expand. Trust me on this. And here's another example of why a group of investors recently sued the company, claiming that UnitedHealth had misled them about its financial outlook following the fatal shooting of their CEO. In mid-May, the new CEO of UnitedHealth, Andrew Whitty, suddenly resigned for, quote, personal reasons. And the company withdrew its earnings guidance to Wall Street for 2025 because they had a disastrous first quarter. A disastrous first quarter? Yeah, they didn't make the kind of money that they had promised Wall Street they were going to make. Too many of these fucking people were dying because they weren't getting the proper care, and we couldn't continue to milk them and get money from the government. We're Medicare Advantage, don't you know? That means we have a pipeline to the Medicare fund, and we can lie, cheat, and steal unless a fucking patient dies. God damn, that's why we wanted DNR. Never mind. Now, United Healthcare is vertically integrated. You know what that means. And because of that, it simultaneously pays for care through United Healthcare and provides care through its healthcare services arm, which is a company I've never heard of, I doubt. Well, maybe you have. It's called Optum, O-P-T-U-M. And that includes both physician practices and pharmacies. And this setup, this vertical integration, that gives the conglomerates enormous leverage to dictate which claims are covered, which physician patients or which doctors that patients can see, and it also gives them control over which medications are prescribed to patients. So in other words, it's not the doctor who makes a decision, and I think this is something Luigi was trying to address, although he did it rather brutally, didn't he? But it's not the doctors who will make the determination as to what kind of care or medication or hospitalization that a patient needs. No, fuck no. I mean, they get in the way. Doctors, nurse practitioners, nurses, physician assistants, they just get in the fucking way. We just have to continue to have those people around to make the dumb fucks who watch our TV commercials buy into the scam. But it means that the doctors who may prescribe a certain medicine for a certain patient, then it goes to review to see whether or not UnitedHealth is going to pay for it. And UnitedHealth will have some probably bookkeeping jerk-off who sits there at a desk and say, well, no, I don't think we'll give Miss Jones this medication. I know. Her doctor says she needs it to stop the growth of cancer cells in her liver. But, fuck it. She's going to die anyway. So, no, we're not going to approve this. If we approve it, it'll mean we have to pay the going price for this kind of drug. And the bitch is going to die anyway. So, yeah, no. Declined. Well, UnitedHealth's Medicare Advantage strategy, according to what this writer has put together, it's proved very, very lucrative. Money, payoffs to the scum, the filth that run the company, the investors, the CEOs, the COOs, all the people who sit there and gouge sick people, dying people, hurt people, desperate people. Hi, Truth Seekers. Mike Malloy here. You know, the Progressive Voices Network brings you commercial-free commentary from today's leading progressive radio hosts and pundits, like me, Mike Malloy, 24 hours a day. I'm not your typical old guy from the 80s or the 90s talk radio host, and Progressive Voices is not your typical talk radio network. It's a listener-supported nonprofit with no corporate control whatsoever over our broadcast. So hosts like me, Mike Malloy, are free to rant and scream and carry on about whatever we like. We're often controversial, but we're never boring. Weeknights, 9 p.m. in the East, 6 p.m. in the West on the Progressive Voices Network. Always progressive, always on. I'm Mike Malloy. Keep it lit.